name is Jack Noble. I'm an assistant professor of electrical engineering and computer science. I'm the principal investigator for the Biomedical Image Analysis for Image-Guided Interventions Lab, or BAGL for short. In my lab, we investigate novel state-of-the-art medical image processing and analysis techniques with an emphasis on using these techniques to solve important clinical problems. So one important clinical area that we're working in is in the area of cochlear implants. Cochlear implants are remarkable devices. They're the standard of care treatment for severe to profound hearing loss. So this is individuals who don't benefit from a hearing aid anymore. And so what they do is in surgery, the surgeon implants an array of electrodes into the inner ear to directly stimulate the auditory nerve to induce hearing sensation. So while these devices work remarkably well for most people, there are highly variable outcomes. And so we're investigating ways we can try to improve outcomes with these devices. One area that we're investigating is image-guided surgery. We're looking at ways we can try to assist the surgeons to better place the devices in the inner ear so that they work better postoperatively and so that cochlear implant patients ultimately have better hearing outcomes. Another project that we're working on is ways that we can help the audiologist program the cochlear implants so that patients can hear better with their device. So for this project, students spend time with audiologists in the sound booth and interact directly with patients who are getting these new settings that we're recommending. And they get to see firsthand how these patients perform with these new settings and get to interact with them to get their feedback on what they think of the different types of settings that we're suggesting. Dr. Gifford is the audiologist that we worked with for that project. Some students who are working in the area of image-guided cochlear implant surgery get to spend time with my collaborator, Dr. Labadie. They get to actually go into the operating room and watch the surgeries and talk with the clinicians while they're operating to try to better understand the types of problems that they're facing. VISE has been really instrumental to my lab, especially because it puts the clinicians who have these important clinical problems in the same room, interacting with the engineers who have the tools to solve the problems. The methods that we're developing will allow us to significantly improve hearing outcomes with cochlear implants, and we believe that these methods will be transformative to the way cochlear implants are done in the future.